this is the licensed acupuncturist and herbalist. Today I'd like to talk about one of the annoying bowel movement problems called Irritable Bowel Syndrome. So most of the people who have these problems, they have bloating, gas, and either diarrhea or constipation. Majority of those people would have diarrhea. Then after diarrhea, they won't have bowel movement for several days, and then they get constipated. So they sometimes take laxative, and sometimes they took coffee to move the bowel. After a few days, they don't have the bowel movement. What caused this problem, irritable bowel syndrome? There are a lot of nerves innervating on the intestinal, colon, stomach, that controls the bowel movement. So normally, if the colon moves regularly, it's called peristalsis from the stomach to small intestine to colon, then you have a good digestion, you have regular bowel movement. But when we pass certain age, the hormones changes and the nerve sensitivity change. So the nerves innervating colon, stomach become hypersensitive. There is a little bit irritation, then the bowel, the colon or stomach will get into spasm, or they will just not move. So for some people, they will have spasm periodically, and then they would have diarrhea. And then after a few days, the bowel movement becomes sluggish, and then they get constipation. And what caused this? Not only because of the nerves, also the hormone imbalance. So women who pass menopause age or just before the menopause, serotonin, GABA, progesterone, all the relaxing hormones are going down. Do you know serotonin also controls your bowel move? So if the serotonin level is dropping, then the peristalsis is not regulated. So it sometimes become hyperactive, and then you get into spasm, diarrhea, and sometimes it just becomes so sluggish, and then things just not moving. And when the serotonin level changes, it also influences your nerve sensitivity. So if you eat something like some greasy food or spicy food, and then it's irritated the nerves on your intestine, then you start having diarrhea. And then when you don't eat enough fibers, and your peristalsis will just become so sluggish. So how we can control this? Because when you don't have the bowel movement for a couple of days, then you get bloated. The stool stay in your intestine for longer, then the toxin will be absorbed into your bloodstream. So you can try acupuncture and also try Chinese herbs. There is reviewed at least 5 studies using acupuncture to treat IBS from 1966 to 2013, and it's randomized, controlled, double-blind trials. Acupuncture can help regulate the regular bowel movement. So when you have spasm of the colon, and it's relieve the spasm to reduce your diarrhea. When you don't have the regular peristalsis, it restores the regular movement. So you will restore your bowel movement and have less pain, less bloating. And not only that, acupuncture help enhance your digestion, so you can absorb the nutrients better. In that way, you have more serotonin, you have more progesterone, so your nerves are more balanced and your bowel move more regularly. If you need more information, you can go to bostonchineseacupuncture.org, or you can email me to ask questions. Thank you.